My name is Fermin Leguen. I'm the Acting Chief Health Officer of the Southern Nevada Health District. Joining here today is Dr. Mike Johnson, is the Director of our Community Health Division, and also Councilman Scott Black, who is the Chair of the Board of Health. As we know, the coronavirus situation is rapidly evolving, and we also want to appreciate your patience and assistance as we strive to keep our community and visitors informed. Today, we are reporting 3 new presumptive positive cases of coronavirus in our community, which brings the total number of cases to 5. It's also important to keep in mind that our investigations are ongoing and that we will be providing additional information as it is confirmed. Having said that, I also want to say that we already received confirmation from the CDC that our first report, the presumptive case, is validated as confirmed. I will ask Dr. Johnson to provide additional information on those cases.
Thank you, Dr. Leguen. Good afternoon. Thank you for being here today. I'm going to provide you with an overview of the cases, but I want to first emphasize that we're working with each of these individuals to identify and inform their close contacts as appropriate. A close contact is defined as someone who was within approximately 6 feet of a confirmed COVID-19 case for a prolonged period of time. Our 3 new presumptive positive cases include a male in his 60s who's isolating at home and is a close contact of a previously reported case, a female in her 70s who is isolating at home and is a close contact of a previously reported case, and a female in her 40s who was hospitalized on March 8th. She is isolated and in stable condition. This individual is a visitor from New York. She arrived in Las Vegas on March 5th and attended the Women of Power Summit at the Mirage. The Health District is working with the facility and conference organizers to identify close contacts of this individual. We want to emphasize that people who are identified as close contacts will be contacted directly by the Health District and provided with information on the steps they need to take. We would also like to thank the Mirage and the conference organizers for their cooperation and assistance with this investigation. People who visited the property or were attendees of the conference who have questions or concerns are encouraged to call our information line at 702-759-INFO or 4686. I will now turn it back over to Dr. Leguen.
Okay, thank you, Mike. Okay, I just want to emphasize that we are reporting today one confirmed case by the CDC that we just received recently, and additional 4 presumptive positive cases that, as we know, require final validation from the CDC. We also want to reiterate that the risk of coronavirus in our community remains low. We are talking about those 5 cases today, so everybody is aware of that. But we also want to make sure that everybody understands that the risk of acquiring a coronavirus infection in our community still remains low. We also want to reiterate the importance of hand washing, respiratory hygiene, good cough etiquette, meaning if you are coughing, sneezing, please use a tissue to cover your mouth or nose or your elbow or sleeve. Also, we want to repeat what we have been saying from the beginning of this outbreak. If you are sick, having respiratory symptoms, it's better that you stay home instead of going back to your job or to public places. And if you are ill, please contact your primary care provider and let them know ahead of time that you are coming to the facility so they can prepare to provide those services for you. And having said that, we are open for questions.
One question here, sir. We are beginning to see conferences canceled here in Southern Nevada. But you're telling us that we are very low risk here. Is this good protocol? Is this something that the health district would recommend, that we start to cancel conferences and large gatherings and that sort of thing, or should we not be doing that?
Thank you. Well, this is one of the challenges of these new diseases or conditions, and we are continually evaluating that. We are looking at the risk of transmission in our community. We are also looking at what is happening in communities surrounding our area. And based on that, we will reach to the decision that we consider is more efficient and protective to our community. But this is part of the consideration that of course, we discuss every day, and I'm certain that we will continue making an assessment of that.
I'm sorry, just to follow up. So should conferences then be canceling? I mean, we've got a major conference coming in this weekend with the president. Is that something that should be concerning for people who are attending, or is that overkill, would you say? Should we just continue, business as usual?
No, what I'm saying is, I'm not saying we continue on business as usual or we canceling conferences today. What I'm saying is, we're reporting this to you today. There are some of the things that we need to take into consideration that we are exploring and we want to explore with our partners here in the community. We haven't made any decision or recommendation about events cancellation because again, this is part of the process that we go with our partners, or what is best for our community at large, and any single thing that happened here. Yes.
Is that independent? I have a question about community spread. And the woman in her 70s who's hospitalized, she had only traveled to Reno beforehand. Does that mean that there is potentially community spread happening in Nevada?
Thank you. Well, based on our investigation, the only travel that this person had is it was within the state, as you mentioned. So it points out to the likelihood of actually being locally acquired, and that's something that we are also looking into.
The first patient you said had traveled to Washington State, so were they on a flight, and were other passengers on the flight notified?
The first patient didn't have signs or symptoms of respiratory disease during traveling. So according to the investigations protocol, when the person presents with signs or symptoms of a disease while traveling, it is reported to the CDC, and then the CDC initiates investigation. That investigation typically involves the people surrounding that person, like 2 seats around. But in this particular case, this patient was without symptoms while traveling, so that didn't trigger that kind of investigation.
What have you said to the Mirage in regards to this woman being at that conference recently and around at least up to 1,000 people likely?
Well, we communicated with the property and we let them know about this, and now we are in the process of investigating with this patient who could be their close contacts, and we are communicating with her, and also we are communicating with the the event organizers as well. So we identify who could have been at risk with her.
Did she mention visiting any other properties on the Strip?
We are investigating that also. Like we want to know every single detail of where she has been during those days, and based on that, we will be approaching the properties or individual who could have been related to her. Yeah.
Right, and I might just add that our disease investigators will be focusing primarily on close contacts with this individual, but we are working with conference organizers in the Mirage as well. It's still under investigation. We're still talking with the patient.
Talking about that, was she traveling with somebody else, and did she show any symptoms during her travel?
She did show symptoms during traveling. We do not believe she was traveling with anyone else.
No, that's it. No, she did. She has let me correct. No, I'm sorry. Just to make a correction, it's so many cases we are going around. This patient presented respiratory signs and symptoms during her travel to Las Vegas, and we are in contact with the CDC just to initiate that investigation, just online with the question that was issued before with patient number 1.
Yeah, and moving forward, how will you identify locations and decide what to tell us about where a patient may have visited? Is it only if they were showing symptoms?
I'm sorry, I couldn't, I don't know exactly what you're asking.
So, for example, last year, for a case of measles, you released they were at several locations. How will it go with these cases moving forward? How will you notify us? When will you decide to notify us about places they may have visited around town?
Okay. Okay. Well, measles transmission is different than this condition. Measles is one of the most highly transmissible diseases, and the risk of people acquiring measles for casual contact is very high, one of the highest among the infectious diseases. So it changed the approach that we have in terms of communication. The same with happened with hepatitis A exposure at restaurants. It's a different approach. So with this condition, what we are looking basically is at close contact, prolonged contact with the index case, in this particular case, this person, and who could have been spending, more time with her, and those would be the people that would be considered as risk.
Okay, we're gonna take 2 more questions, and then we're gonna wrap up. We're gonna take 2 more questions.
Dr. Leguen, the State Attorney General said that anyone who willfully violates a mandated quarantine could be charged. Will the Southern Nevada Health District have a role in ensuring that those who are asked to stay at home, to isolate at home, will remain there?
Thank you for asking the question. Well, that's the law in Nevada. So if we ask somebody to stay home and be quarantined because it's a risk of transmission to the community, and it is violated, that person could be subject to legal repercussion for cause.
Have a role in ensuring that that person stays at the home? Is it an honor system, or they have some type of?
Okay. Where's Kim? You want to explain the detail of how we do that surveillance? Yeah. So we.
For the 2 patients that were identified as close contacts, the 2 patients announced today, how are they related to the person that they were exposed to? What was the relationship?
They share the same household.
Okay.
Yes.
Are those 2 people with one person that you were exposed? So we have the man in his 50s, the woman in his 70s. Were both of the 2 new patients either with the man in his 50s or the woman in her 70s?
Oh, those are related to patient number 2, which is the woman in her 70s.
How many test kits would have you
No,
been doing?
okay, we're gonna take 1 more question over here.
Well, again, this is a new condition that we are learning about this as we move forward, like, you know, all institutions across the state and the federal level. So what we're saying today is, for us today, the most important thing is to share this information with the public. Also, reassure our community that as today, the level of transmission of this disease in Clark County is considered low. If that change, we will communicate that to you as well. We don't see a reason for our community to panic about this today, based on what is happening today. Again, we are talking about 5 patients in a population of more than 2 million people, and those patients have been isolated. They have been receiving treatment from the medical providers, and our medical facilities are fully equipped to provide care for this particular condition. So at this point, I would say there is no reason for our community to be in any panic. It's more about understanding the disease and taking the measure to protect yourself and those who surround you. And that's why we are insisting on all those measures that we mentioned before that are valid not just for the coronavirus, but also for the flu, which still is surrounding us. And the personal protection for coronavirus as today are similar to what we are asking people to do about the flu. And again, if somebody is present with respiratory symptoms, fever, cough, it's better that they stay home than going to the job or going to public places.
How many testing do we have here, and do we have enough?
Okay, that's the last. That will be the last. Yes, sir. No, our lab has 800 tests right now. They are receiving additional shipment from the CDC, and so this is something that is ongoing. We also, in collaboration with the governor's office, we are expecting to receive about 20,000 tests in the near future, and that's a request from the state to the CDC.
Thank you, and we appreciate your patience. This is an ongoing situation, like we've said, and we'll provide you with an update at 10